Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
Go above and beyond.
they become very good at what they do, but only
0.1%.
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
With Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius Podcast. We've got a great guest today, Bob Hariri. He's a surgeon, a biomedical scientist, and co-founder of Fountain Life. He's co-founded it with Tony Robbins, Peter Diamandis, and Bill Kapp. He's a CEO also of Cellularity Incorporated. And, listeners may know Tony Robbins. He's been a speaker for decades, in the personal development space. Peter Diamandis, founder of the X Prize, also tremendous credentials. So I'm honored to interview Bob today. We're going to talk about using pluripotent stem cells from human placentas to treat life-threatening diseases. So welcome, Bob. Thanks for coming.
Well, thanks for having me, Rich.
Yeah. How did this idea first come onto your radar as a possibility to harvest these stem cells?
So you may remember that going back as far back as 30, 35 years ago, stem cells emerged on the landscape in biomedicine as a discovery that got people thinking that we might be able to use living cells as therapeutics to turn back on some of the natural regenerative processes that we need in response to injury or disease. And at the time, I was a young surgeon and scientist at Cornell Medical Center in New York, and my area of clinical focus was head and spinal cord injury, really devastating neurologic injuries that often left patients devastated. And despite tremendous amount of research looking at the mechanism responsible for these irreversible injuries, we didn't have tools to do much for it. And when I began to spend time looking at stem cells as a potential therapeutic, it became apparent that if we could literally reduce living cells to medicines, we could, in fact, possibly change the natural history of those injuries, and as a consequence, might open the door to using cell therapy and cellular medicine as a way to treat a whole range of serious and life-altering conditions. So that got me fascinated by the scientific possibilities, but as a guy who trained as an engineer before I ever became a surgeon, it was very, very clear to me that for stem cells and cellular medicine to have a role in healthcare, someone was going to have to turn living cells into medicines and productize them like pharmaceuticals. And that in my mind, that was more of an engineering feat rather than just purely a biomedical scientific objective. And so I began to think about, look, where you get these cells is going to matter. Can you produce these cells in a scalable, economical way with the kind of quality controls you put around, chemical pharmaceuticals? And could you ultimately put these into the healthcare setting so that doctors could use it without having to go through some ridiculously complicated amount of training? In other words, for it to have an impact in healthcare, docs were going to have to be able to use these things the way they're used to using products like pharmaceuticals. So that was the challenge. And that's how I got interested in the field.
All right. As I understand it, everyone has stem cells in their body, and that they appear to decrease with age. But can you say a little bit more about what we already have and when these stem cells come into play and, what they can fix and what they can't fix?
Well, that's a great question. So if you think about it, right, we all originate from a single cell. At the time of fertilization, a single cell called a totipotent stem cell gives rise to, in your lifetime, trillions and trillions of cells, perhaps several hundred trillion cells that all derive from that same starting original cell. And during your lifetime, these cells divide and specialize to populate the different organs and tissues of your body, and they take on very, very discrete and very specialized functions like cells of your brain, cells of your heart, of your bone, of your muscle. And it's the ability for a cell type to give rise to all these different specialized forms that is what gives stem cells their unique properties. And that property is that they can differentiate and specialize in very, very versatile ways. Now, as we age, these cells are called upon, these stem cells are called upon to renovate and renew our organs and tissues, and they have to do so with a tremendous amount of fidelity. They've got to be really, really good at making perfect copies of themselves and specializing. And over time, that ability is lost as we exhaust the pool of stem cells that were originally resident in our bodies. And in addition to losing that reservoir, what's remaining in the reservoir becomes changed or corrupted and damaged to a point that they no longer perform the functions perfectly. And that's one of the reasons why we start aging. We exhaust the reservoir of stem cells in our body, and the stem cells we have left get damaged. So an obvious potential solution would be to be able to replace or protect those stem cells. And if you could replace them with perfect copies, you could potentially extend the window of health well into our advanced years and maybe delay the onset of the degenerative diseases and serious age-related things like cancer that everyone fears.
For a given tissue, where are the new cells coming from? Are they coming from the division of existing cells, or are they coming from stem cells that are then differentiating to become that tissue?
So some of the cells actually take up residence early in the process of forming that organ or tissue, and most of them reside in different places, like around the periphery of the small blood vessels that invest the organ. Some are resident deep within the tissue itself, and they stay in what's called a quiescent state. They are still maintaining their stem-like characteristics, but they haven't yet been called upon to, for example, renovate or repair a part of the organ that may have just aged, worn out, or become damaged by disease. And so over time, you use up that reservoir, and in some cases, you can't augment it with cells that come from other parts of your body. What we know is that there are reservoirs of stem cells in our bone marrow and in other parts of our body, like certain organs that are part of what we call the reticuloendothelial system. This is a part of our circulation that you can find in liver, in spleen, in bone marrow. In some cases, you can find this in your muscle tissue, and those stem cells can sometimes be called upon to migrate to an area of need and do that work of replacing, renovating, and repairing you. But as those things wear out, you're out of luck unless you can supply yourself with cells that you may have had from another source, or that you were smart enough to store early in life.
So within a given organ, let's say, I don't know, the liver, are stem cells that are associated early on with the liver the ones doing the repair when it's needed, or can our body take stem cells from another place, another reserve, have them go to the liver and then differentiate into liver cells, or differentiate and become liver stem-like cells?
So that's a great point. You have some cells which reside in the organ itself, which can be called upon. And then there are some cells which can migrate from other places, like your bone marrow, that once they get to the liver and they respond to chemical signals to recruit and attract them, once they get there, they will differentiate appropriately to become new liver tissue or supporting tissue. And that's a process that we know occurs, because in patients who get, for example, bone marrow transplants, some of the cells that are destined to go to bone marrow that wind up in the liver actually become normal liver tissue. And so stem cells are very, very smart. They're very versatile. They have great replication potential, and they can figure out where they've taken up residence, and they can behave in an appropriate manner to repair and renovate that tissue.
So what is the protocol that you've been working on? Is it to draw cells out of the body that are already differentiated and put them back into a stem cell-like state? Or do you have to harvest stem cells from someone's body and then culture them and proliferate them? Like, what's the method here?
So we were the beneficiaries some 30 years ago of the recognition as bone marrow transplant began to become more commonly used as an adjunct to the treatment of different cancers. We were the beneficiaries of work that showed that the same stem cells that you can get from a bone marrow donor that's used for bone marrow transplantation, similar cells could be found left over in the umbilical cord blood after a child's been born and the placenta is being discarded. That umbilical cord blood is rich in a type of stem cell that can be isolated and can be used to replace bone marrow. Rather than use a bone marrow donor, you can use umbilical cord-derived stem cells to do the same thing. And at that time, we recognized that since these cells are coming from the placenta and finding their way into that blood, that perhaps the placenta is an ideal source of cells for more broad uses.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
And so about 25 years ago, I made the discovery that the leftover cells in the placenta after a full-term healthy pregnancy, prior to the placenta being disposed of, could be isolated and harvested, and they can be used to establish a kind of a pool or a bank of cells that could be called on later in life for anything from the obvious use in bone marrow transplant to the emerging field of regenerative medicine. And so I established a company to do this, and we did it as part of a service of banking the leftover cells after birth, and invested heavily in researching how to drive those cells to be applicable to different things, like regenerative medicine, for example, repairing your muscle tissue, repairing other organs and tissues, not just bone marrow. And then as the field evolved and it became clear that if you can use immune cells derived from these starting placental cells, you might be able to support the treatment of cancer, autoimmune disease, and a whole host of other disorders. So if you think about it, if I can collect cells at birth and store them away, and the process of storing them away is called cryopreservation, and we now know that you can freeze cells at ultra-low temperatures, minus 180 degrees centigrade, and those cells are good for the lifetime of the donor. And that means they can be thawed at any point and then given back to the donor, and they can take on the role that they did normally and under normal circumstances, but they can be used to support or augment your own reservoir of cells that you might be either using up or might be damaged during your lifetime. So the obvious ideal situation is that everybody at birth has an opportunity to store away some of these very valuable stem cells. We now know that you can even do this later on in life, because your cells today are always going to be younger and preferably healthier than cells that you might be able to collect 10 years from now. And so the same company that offered placental and cord blood stem cell banking for the last 25 years has just launched another program to do this for adults, and we consider it a way of backing up your biology. And so the concept of the bio backup is a way of thinking that your cells at any point in your lifetime are always going to be biologically superior to your cells later on in life.
Okay. So if someone's 45 and it's never too late to do this, I guess, because if they bank their cells at...
Right. It's better to do it at 45 than to do it at 65.
Okay. Makes sense. And going back quickly to the placental cells, what's the typical composition of a placenta, and how much of a bank is it, and for what types of conditions?
So, we can isolate and harvest, hundreds of millions of stem cells from the placenta, and they can be processed and cryopreserved, frozen, and they can be thawed later on in life, and then they can be either given back in their native form, or they can be the platform for engineering cells. And today we understand that you can you can take a stem cell and derive immune cells like T cells or natural killer cells, and you can use them to support an immune application like treating cancer or autoimmune disease or even infectious disease. I know you have an interest in COVID. We actually showed that we can take placental natural killer cells, which are nature's first line of defense against viral infection, and we can use that to treat serious viral infections by augmenting a patient's response to those viruses with more active cells that are designed by nature to hunt and destroy virally infected cells. So the future is very, very bright for this field, because if you have the starting material, you can pretty much turn it into anything you might need for regenerative medicine or immunotherapy.
So cells harvested not from a placenta, but from a person's own body, do you have to induce pluripotency in them for them to be used, later on for that person?
It all depends upon what your objective is. If you needed to induce pluripotency because, for example, you wanted to use a patient's, for example, hematopoietic or blood stem cells to produce muscle tissue, you could put them through the process of inducing pluripotency, and that's a technology that, as you know, is the basis of a Nobel Prize by a scientist named Yamanaka, who showed that you can take a specialized cell, a mature specialized cell, and kind of turn the clock back and make it act like a more immature stem cell. But for immunotherapies, all you really need to do is take the blood-forming stem cells and allow them to produce T lymphocytes, a type of white blood cell, or natural killer cells, and use those as a tool for controlling cancer or other serious diseases. So you have different options. If you have the starting material in the form of the stem-like form, you can drive it to produce a whole range of mature cells that can do different things.
So let's say you have a husband and wife, they have a child, they harvest the placenta. Can those cells be used only for the baby, as it throughout its life, or can they be used for the mother, and could they be used for the father? I know there's ethical and other issues around this, but where could they be used and in whom?
So it turns out that stem cells from the placenta can be used obviously for the donor themselves. They're very often used in what's called a related allogeneic transplant, which means that siblings might be suitable recipients of those cells. But we've done a lot of the pioneering work to show that the placenta is unique in that it functions as nature's universal donor tissue. So if you think about it, okay, the placenta, which is made by the same cells that make the developing embryo and fetus after fertilization, that organ resides in the maternal host, who's only a 50% source of the DNA in those cells, so she's an imperfect match, yet the placenta is not rejected by the maternal host during 9 months of gestation. The mother is an imperfect match to the developing placenta and fetus, yet she doesn't recognize it as a foreign graft or a foreign body. Think about surrogate pregnancy, where the mother is not even related to the developing fetus or its placenta, and she doesn't reject the placenta. She'll carry it for 9 months in what's called a tolerant immunologic relationship. That means that placental cells, and we've shown this in clinical trials, placental cells can be administered to unrelated, unmatched recipients, and they're very well tolerated. And so that is one of the unique features of the placenta as a source of cells for the field of cellular medicine. It allows you to have kind of a one-size-fits-all cellular product.
Yeah, that's amazing. And again, the father too possibly could benefit from at least a 50% match DNA-wise, all from the placenta.
And it's been our mission for the last 20 years to turn these placental-derived cells into therapeutic products that can be fully allogeneic, meaning that they can be used in unmatched recipients and tolerated so that they can exert their biological activity and provide the clinical benefits without having to find a perfect match.
What about if placental cells were authorized to be used for a more distant family member or a non-family member?
Yeah.
I know there's a lot of ethics involved, but what would be the efficacy of doing so?
Well, the ethical issues, are really limited to whether or not you deprive the donor of any access to material that they may need. In terms of the ethics behind allogeneic transplantation, that's already been well established in the conventional bone marrow transplant world where, people who under full informed consent are willing to donate their cells for use by another. That doesn't violate any specific, ethical or moral standard. But the beauty of the placenta is that we can harvest enough cells from a single placenta and we can mass produce them so that there's more than enough to treat a whole host of recipients, the donor, the donor's relatives, and even unrelated recipients. That's what makes the placenta an ideal source material for this field because, number one, the cells can be tolerated without having to match, and number two, they're highly expandable, and so from one placenta we can make thousands to hundreds of thousands of doses of product. So that is why, we at Cellularity have been very, very focused on the placenta as the ideal source of cells for regenerative medicine and cell therapy.
Yeah, I mean, some really, I thought about a black market in these things, which, I'm sure would arise and who can control. But, what if, I don't know, someone has cancer and they know a family that they're friends with that they're about to have a baby and they say, hey, could we set something up where the placental cells from the delivery, we could get a small part of them to hopefully treat so-and-so's cancer? Will the work you're doing be big enough that there'll be a number of clinics, around the U.S. and maybe around the world where you wouldn't have to do something like that? It would just be commercially available.
Yeah, that's absolutely the entire focus of our research and development efforts at Cellularity is to make off-the-shelf, fully allogeneic, scalable cell therapeutics that can be delivered to anybody in need without compromising the availability of those cells for the donor themselves, the donor's family, etc. Again, that's one of the beauties of using the placenta. If you think about it, as I mentioned before, we all start out as a single cell. One of the first things that cell does is make the placenta and the developing embryo. That placenta is the source of cells which help to build that newborn, that fetus and that newborn. And then those cells that are first occupying the organs and tissues of the newborn, those cells all came from the placenta, and they'll take up residence and they'll populate that newborn throughout its lifetime so that the 90-year-old that comes from that original cell material is still producing progeny from the original material that started life 90 years earlier. So the incredible replication power of cells from the placenta, plus their ability to be a universal donor, makes this the ideal place to develop therapeutics that can serve not just the donor and family, but even completely unrelated recipients.
Okay, and I know you got to go soon. Last question or two: how long and what steps are necessary to go from here to making this widely available for people?
So, the work that we're doing at Cellularity is very much analogous to the kind of work that's done in developing new therapeutic biologic products or pharmaceuticals. There's a series of clinical studies which have to be done to demonstrate safety, efficacy in specific indications. And then there's the dialogue you have with the regulatory agencies at the FDA and other jurisdictions like the European EMEA, et cetera. And that's what companies like ours are focused on. And it's a long, expensive process, but once these products reach that level of approval, they're highly leverageable, and that's where the field is moving today. I'm excited that after investing 20 years in this work, I see the horizon is very rich with opportunities to use cell therapy to treat serious things like cancer, but even the more mainstream disorders like age-related degenerative diseases, and the future is bright for cell therapy being a cornerstone of healthcare.
Yeah, this is amazing. So, Bob, what's the best place for listeners to keep tabs on what's going on and the progress? Where can they go?
But Rich, I'd love them to either visit our company's website at cellularity.com, and that's CELULARITY.com. They can also visit fountainlife.com. That's our clinic system that you mentioned earlier. They can also follow me on my podcast, which is pilotinghealth.com. And Piloting Health relates to my kind of dual world of aviation and biology, but on piloting health, which you can find on most social media platforms. We talk a lot about these areas and range from cell therapy, regenerative medicine, to precision medicine and health and wellness. So happy to see any of your listeners follow us there.
Excellent. Thanks so much for coming on the podcast. I really appreciate it. And the work you do is truly groundbreaking. It's going to be amazing to see this available for people in the future.
Well, I really appreciate you inviting me, and congratulations on your great work as well, Red. Thank you.
Thank you.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.